Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning, everyone, and welcome to the Senior Moment Show. My name is Bryce Patton, here by myself. Sid is actually not with us today, and so it's just me and my wonderful guest. Before we get to our guest, I'd like to talk about our sponsor, which is the Empowering Seniors Group, which is a bunch of individuals and organizations who have come together to educate and help inform our seniors on all the different services and help that they have available out there to make sure they can live their best life possible. If you would like to know more about the Empowering Seniors Group, you can check them out at empoweringseniors.info, or you can email us if you have any questions or have any recommendations for guests. You can email us at empoweringseniors.cv@gmail.com, and the CV stands for Cache Valley. Or you can call Sid, and since she's not here, I get to say you can call her whenever you want, middle of the night or whatever you want. And call her at 435-512-6406. All right, we have a wonderful guest with us today. It's our first time coming on. This is Dr. Landon Watts, a geriatrician over at IHC. Welcome to the show.
Thanks for having me. Appreciate it.
So I was curious, so you're a doctor, but I want to know how did you come about wanting to be a geriatrician?
Great question. There's not a ton of geriatricians out there. I wish there were more. Probably the thing that really got me down the path to becoming a geriatrician was a great mentor in my internal medicine residency, which I did in Oregon. Dr. Scotty Church, just fantastic physician, very practical, kind of no-nonsense demeanor. And she really worked with a lot of older adults to help them get off of medicines that were unnecessary, and just was a great communicator. And people really appreciated that. And as I rubbed shoulders with her as a trainee, I came to really love working with older adults and just saw that there was so much value in focusing on quality of life and, balancing that, but also understanding when is that more important than sometimes quantity of life.
Oh, definitely. So you were up in Oregon, but you're a local guy, right? You're from Preston, Idaho, and you went to Utah State as well.
Well, so I do have family in Preston. I grew up in Boise, but yeah, I did go to college at Utah State and absolutely loved it, and pretty much fell in love with the Cache Valley the moment I got here as a college kid. Yeah, several years ago.
Oh, that's awesome. All right. Well, you mentioned something earlier that kind of gets my brain going when you start talking about prescriptions and getting off medications and things. I used to work at the pharmacies here in town, and so that hits home. So for you, when someone comes in, is that something that you check regularly?
Oh, absolutely. Yeah. In fact, we actually have a policy at my clinic that when new patients come in or consults come in for geriatric questions, so it's my first time meeting them, we always request that they bring in all of their physical medicines, the bottles, the bags, you name it, the sprays. And I try to get all of those medicines physically present so that we can see, and over-the-counter medicines, to kind of go through them one by one, because there are just a ton of issues that I see with drug interactions and just the number of medicines, which is a term we call polypharmacy, when you're on just a ton of medications. And has anybody really taken a magnifying glass and really looked at each of those to say, why are we on each and every one of these?
So what do you usually find when that happens? You find that people just have all these expired drugs that are sitting at their house, or do you find that they're just having a whole bunch of medicine that is counteracting one another?
Especially the latter, but certainly there are medications that are expired or old bottles, and definitely creams are expired. And then people tell me, my antifungal cream isn't working, my over-the-counter. I would say, well, how long have you had that thing? You're like, 5 years. I'm like, no wonder it's not working. But in terms of like prescription medicines, a lot of them, what I do find is it's the drug interactions that's a concern for me, and especially in older adults, the side effects. So a lot of medicines that we take in our younger years of life those same medicines, because our organs slow down, our body when we're 40 and 50 is not the same body we have when we're 70 and 80. And we forget that. We say, I've been taking the same medicine for years, so it should work the same. Well, your body's not the same. So that's a fallacy, unfortunately. And so I do a lot of education, and my staff do a lot of education to help people understand that, so that we can look at these medicines kind of with a new eye and make sure that they're really doing what they're supposed to.
What kind of things do you see then when you're, I guess, what are the things that you see most common when the drug interactions or that you see, hey, maybe I've been taking this prescription for the last 20 years, why isn't it being as efficient?
Yeah, so just to give like an example, the other day I saw someone who she has urinary urgency, so having a rush to make it to the bathroom. This is a common thing in older adults, especially women, but men as well. So we have medications for that, but a lot of times they have a range of side effects, and the side effects aren't as noticeable when your organs are younger and metabolizing the medicine faster. But as you age, it's just those side effects really tend to pop out. And so I asked her, I said, do you have dry mouth? And she said, I do. And I said, well, I think that's from the medicine you're on, and we should try to change that to a different medicine. And sometimes that approach works, and sometimes we can't change the medicine for a myriad of reasons. But that's a simple example of a single medicine causing problems. But we also have what's called a prescribing cascade, is a term that we use when someone's on a medicine, they have a side effect, and they're prescribed a new medicine to treat that side effect from the original medicine. And this is extremely common. Pain medicines, opioids, they cause constipation. So now older adults who are already at higher risk of constipation are taking Miralax, they're taking Docusate and Senna and stool softeners, everything you can think of under the counter just to help their bowels function right when they're getting worsened and slowed down by a pain medicine that, frankly, many times the opioids stop working well. So having a critical eye to reanalyze all that and peel back and pull back all these medicines, I think is a very important aspect of geriatric medicine.
Do you take on new clients just for that?
No. I also do primary care. So I'm a primary care physician and a geriatrician. What that means is I see older adults and manage their primary care. Some adults also come to me as consults, and I just manage geriatric aspects of their care, and they keep their primary care physician. Okay, well, I'm curious.
We're coming up on the last little bit, but real quick, how long does that visit take when you sit down and go over their medicine?
These visits, depending on the number of medicines, can be very long, and thankfully my schedule accommodates for that. So I will the total visit from beginning to end can be 75 minutes on the first visit.
Oh, wow.
Or longer.
Well, so if someone is curious and wants to set up a time to go through this with you, what's a good way to contact you?
So our office phone number is 435-716-4900. And I work in the East Logan Clinic, like you mentioned, with Intermountain Health. Our address is 550 East, 1400 North, Suite Y, here in Logan.
Oh, that's fantastic. This is the Senior Moment Show. We'll be right back.
This is Scott Howder with White Pine Funeral Services. For generations, family has meant everything here in Cache Valley, and when families need compassion most, they turn to White Pine Funeral Services. Whether you're planning ahead to ease the burden on loved ones or honoring a life with dignity and care, White Pine Funeral Services is here to guide you every step of the way. Thank you, Cache Valley, for allowing White Pine to serve this incredible community with compassion, respect, and heartfelt care. Learn more about pre-planning and available services today at whitepinefunerals.com or visit us at 753 South, 100 East in Logan.
White Pine Funeral Services, here when you need us most.
Getting around your home should be easy and safe. At RT Med Mobile, they provide wheelchairs, stair lifts, ramps, and electric lift chairs to help seniors maintain independence and comfort. Their friendly team offers free in-home consultations to find the perfect solution for you or your loved one. Locally owned and here to help. Call 435-260-6171 today. RT Med Mobile, because your mobility matters.
Thanks, Mom. Thanks, Dad.
No problem, sweetie.
I can't believe you're able to fit everything in that little sedan.
Bye!
When they move out, you can move on to a house that fits your life. It's time to live in a space that fits your family.
Hi, this is Sid Roeder with Achievement Realty.
Let me help you to find a home that suits your needs and is less to take care of. Save money or even make money on the sale of your current home. Call me today at 512-6406. Then list it, sell it, and move on.
Caring for a loved one is as natural as the weather. But just like the weather, one moment it's sunny and the next you might find yourself in a storm. So when it came time to take care of my dad, I knew I needed help. That's why I chose Maple Springs Senior Living in North Logan. Their people are so caring, so experienced, and that's making all the difference in Dad's life and mine. I can rest easy thanks to Maple Springs in North Logan.
Making every moment matter.
Learn more at maplesprings.living.com.
Need a helping hand? The Bear River Association of Governments, also known as BRAG, is here for you.
They assist seniors with in-home services, provide utility bill relief through the HEAT program, and offer rental assistance to keep you housed.
Need help with tax prep? Their experts ensure you get the refund you deserve. And for veterans, they're here to connect you with the benefits you've earned.
BRAG is your local resource for a stronger today and a more secure future. Call today or visit brag.utah.gov.
And welcome back. This is the Senior Moment Show. My name is Bryce Patton, here by myself. Well, at least without my co-host Sid. I'm with my guest, Dr. Landon Watts, a geriatrician over at IHC. And Landon, we were talking about all medicine and how that interacts with different things. Do you do anything besides medicine? Do you work, I guess my real question is dementia, Alzheimer's. That's a big topic in my line of work. Do you deal with that much?
Oh, absolutely. Yeah, I'd say neurology or neurologists and geriatricians both work heavily in that realm, generally speaking.
Oh, that's awesome. So what do you see a lot of people just coming in when their spouse is kind of like, I can't handle them anymore? Or did people start coming in early?
You know, we get the whole range. I've definitely had people who come in and they are really proactive. They're really, noticing things and catching them pretty early on. And I've also had a lot of people come in and we're almost putting out pretty big fires, safety issues, wandering and dementia, driving when it's not safe, all sorts of things that really should have and unfortunately weren't caught a little bit sooner.
Uh-huh. So do you have any advice for someone that, let's say they notice their mom is starting to be a little more forgetful? Is that a good time for them to start coming in and seeing you, or do they need to wait till it's really just glaring them in the face?
Never wait. I think, it's always better to get things checked out sooner than later. And I've definitely seen how it plays out so much better if we get someone in sooner. Even if we're not sure or, a loved one's not sure that it's dementia, there are so many other things that could be going on with cognition. So getting in there sooner, it just really benefits the patient so that we can make sure we take a critical look at medications. Like we were talking about polypharmacy, there's so many medicines that can affect cognition. So it would be a great thing to catch that early as well. But certainly if someone is starting to develop dementia, that opens up a conversation that's really important to have and way more effective if we can have it earlier.
So we get a lot of people that, they just say, oh, this is just a sign of old age, right? They just like, oh, I'm just getting older and this is just kind of how it is. Do you have any signs or things that you look out, that people should be on the lookout for, that maybe is a trigger to think, oh, maybe we should go get checked out?
Absolutely. Some of the earlier things I think that we pick up on have to do with, one example would be technology. So if someone has the same phone or a computer and they've typically been able to utilize that device to a certain level consistently in their life, and all of a sudden that's starting to change. We're having a harder time using it. There hasn't been an update or change in that device. That should raise a question like, why are things getting harder if nothing else has changed? Same thing with, I saw a patient who was really good at mechanical work. And his, I think, daughter mentioned, Dr. Watts, he's been having a way harder time, and he just gets way more frustrated working on cars and things. But this is something he's been doing his whole life. That's a change. When we have changes like that, those are early signs of potential issues with cognition that might be early development of dementia. Another one is repeating oneself. It's normal to always remember what your spouse told you, but it's not normal to ask them 3 times in the same day for the same piece of information. generally speaking. Sometimes, though, hearing can mask that. So that's my job, is to start to work through that and say, is hearing really the issue? Is attention really the issue? Or is this actually my memory and cognition are the issue? And so we work through that. But that is a common thing I find, is if someone's repeating themselves or forgetting important dates and that was not their personality, they're generally a pretty organized person, those would all be clues that something like dementia could be occurring.
Okay. So when they do come in, what are some of the treatments that you've seen work for this? Or are there treatments that work for dementia and memory loss?
It's a great question. I think sometimes people are disappointed when they hope that we have a really good cure for dementia. In reality, when I say dementia, there's like more than 7 different kinds of dementia, and each one can have particular treatments. But the overlying commonality does also have, or common thread rather, has treatments for it as well. But most of the treatments that are most effective are not necessarily medicines. It's usually behavioral and lifestyle changes, setting up things for safety. And also education is a huge part of what I do, helping families understand the trajectory of what dementia looks like so that we can be prepared emotionally, so that we're proactive about care for dementia rather than trying to put out fires down the road. Are there medicines? Absolutely. There are medicines for dementia. And sometimes getting rid of medicines that are hampering cognition is one of the treatments for dementia. In terms of medicines that actually help with memory and cognition, there are a few. Their effectiveness or efficacy is debatable, but it has been shown. And so I always walk through that with patients, and we have a shared, risk versus benefit discussion, and really try to make sure that if we do start a medicine, we know why we're starting it, and we know what we're looking for in terms of treatment goals.
Oh, that's fantastic. I used to run Alzheimer's support group, and one of the daughters that would come, she asked me once, and it's always kind of weighed on me, but she said, hey, my dad loved to tinker. If we had not taken over his care and put him in a facility, would have his dementia got as bad as it did? What do you think on that?
So when you say tinker...
just go out into the garage and mess with things and stimulate his brain?
I see, yeah. No, absolutely. So a lot of times I talk to people about the 6 pillars of brain health. I won't go into all those today for sake of time, but what I will say is there are many things that a person can do to help stimulate their brain that aren't medicines and may work just as well. And so certainly staying active, having hobbies, learning new skills, new languages, doing games, not by yourself though, but with people, and especially not socially isolating oneself, but rather interacting with people on a regular basis. All of those things are paramount to trying to slow the worsening of cognition and dementia, and I find that they're also really quality of life things. And so it's really fun for me to educate patients on that and see how we can really help them on things that don't have side effects like medicines.
Do you, when you're doing this, real quick before we get to our next break, do you set up like a treatment plan, like a social treatment plan or a cognitive plan like that, or is that just some general advice that you give?
It depends. I try to meet people where they're at. I wouldn't say I'm an expert at creating individualized plans for social interaction. Dementia also affects people where a lot of times they aren't as interested in social interaction, and I don't want to push people to do things they don't want. But encouragement and finding and exploring with them what they might be interested in doing, I definitely go down that with them, and usually the loved one is really the person who knows them best to help them really figure out the specific plan.
Oh, that's fantastic. Well, I love it. I know that there's a big need here in our community with the dementia, and we'll get your contact information after the break. So everyone get your pen and paper, and we will do that. Again, this is the Senior Moment Show. We'll be right back.
Did you know that one of the greatest threats to our quality of life is a fall? 1/3 of Americans 65 and older, and 1/2 of those over 80 will fall this year. Many will never be the same again, and some will never return to their homes. This is Bruce at Comfort Care. One of the ways we can help people stay in their home is through our free in-home fall protection survey. Let us help you identify these fall risks. Call us at 754-7676. Comfort Care, 754-7676.
This is Scott Robinson, owner of Cache Valley Pharmacy. At Cache Valley Pharmacy, we offer so many services, from free delivery to custom packaging. We pride ourselves in our compounding. We love it so much that we've partnered with Focus Pharmacology, Cache Valley's own premier supplement line, and we're throwing in a free bottle of supplements with every new custom compound prescription. You heard me right, a free bottle with every new compounded prescription. So when your doctor asks where you want your prescription sent, tell them Cache Valley Pharmacy. Cache Valley Pharmacy, keeping it local, online at cachevalleypharmacy.com.
Are you tired of feeling unwell and not knowing why? At Next Level Health and Wellness, we hear you. We specialize in uncovering the root causes of your discomfort, whether it's gut health, hormone imbalances, or emotional and mental blocks. With personalized plans, advanced lab testing, and evidence-based holistic nutrition practices, we guide you toward lasting health and wholeness. Awaken your healing potential with a team that listens, understands, and supports you wherever you are. Visit nextlevelhw.com to start your journey to feeling better today.
Did you know 1 in 3 people will visit a nursing home? Did you know that once there, they will stay there for an average of 3 years? Did you also know there are insurance options that can help cover this experience? Hi, I'm Tracy Ferris with Blue Water Health Insurance. It's not cheap to stay in a full-fledged nursing home. Long-term care insurance can help you or a loved one get the care they need and deserve. If you wait until you need it, you may be too late. Give me a call at 435-890-8155.
Picture this. Your family's locked in court, fighting over your home and your assets because there was no plan. Don't let probate decide your future. I'm attorney Justin Wall with Wall Estate Solutions. Stay in control with wills, trusts, and smart planning that keeps your family out of court and your wishes protected. Get peace of mind today. Visit wallestate.law or call 435-294-0346. That's 435-294-0346. Your legacy, your plan.
And welcome back to the Senior Moment Show. My name is Bryce Patton, and we've been joined with our guest, Dr. Landon Watts from the IHC East Clinic. Before, you were talking about dementia in our past segment, and so if anyone has concerns about a loved one or maybe even themselves, what's a good phone number that they can call and get an appointment and talk to you and maybe work through these things?
Great question. Yeah, so my office is right next to Spence's Pharmacy. It's 550 East, 1400 North, Suite Y in Logan. And our office number is 435-716-4900. So that's probably the best way to do that. I do have some scheduling criteria, but on that criteria, anyone who has cognitive concerns or concerns about dementia, that's kind of an automatic, I will see the patient and do a workup.
Oh, that's fantastic. Well, so we were talking about dementia in this last one, and that one, it can open up a whole can of worms. If someone right now is living with somebody that the cognition is just declining, do you have any tips or tricks for safety, especially to work with them and help them make sure they're safe in their home as they're aging and going through this process?
Absolutely. I can't take credit for a couple of the easy to remember tips I'm going to give right now. So I'm going to talk about different aspects of safety, but before I do, perhaps the very first thing is actually communication in dementia. You know, a lot of times the same logical and deductive reasoning skills we can use to help have a discussion with someone, they start to fail in dementia. And the reason often is because the frontal lobe of the brain is affected in such a way that our loved ones with dementia, oftentimes they have poor insight into what's really going on and contextually what's an important priority or a problem. And that affects their judgment so that they make poor judgment calls on some things. They may say, I'm safe to drive. I'm safe to go out and do this thing. And clearly they're not. And so the first part is, how do we communicate with our loved ones? And this is where I say I can't take credit for this, but I got a great little, it's not quite a mnemonic, but my mentor down at the University of Utah used to say, avoid the 2 C's and do the 3 D's. And so I'm going to say those now. Of the 3 D's, when you're communicating with someone, you want to distract them if they get hung up on something, or redirect them, or do nothing. And a lot of times, then it will just go away. They'll forget about it, and you can move on, and that avoids a lot of conflict, which is great. And then, of course, the 2 C's to avoid are avoid correction and avoid confrontation. And a lot of times if people adhere to those things, they're able to really kind of resolve and put out a lot of emotional and conversational fires that can happen with someone with dementia. It's tempting to try to argue and reason, but unfortunately, most of those reasoning skills in folks with dementia as it progresses are lost. And so it's better to actually distract, redirect, and do nothing. But going back to your question about, are there specific things with safety that we really need to watch out for? Absolutely. I would say one of the first ones is, are there any firearms in the home? Right. And I'd say if there are, they need to be locked up, and the key needs to be with the loved one, not with the patient who has dementia. For the same reasons I mentioned about insight and judgment, there's just a high risk of problems potentially there. Another huge one is driving. A lot of times we ask our loved one who might have dementia, have you had any issues driving? And they'll say, absolutely not, I'm fine. But remember, because the disease affects insight and judgment in many cases, they won't be able to actually accurately tell us if driving is safe or not. Some can, some have good insight, but many don't. And so this is where I often encourage caregivers and loved ones to, if safe to do so, ride in the car with them and see, is this safe or not? Do I feel safe? And if the answer is no, then we really need to have a very quick discussion about voluntarily giving up a driver's license, or at the very least going to the DLD and having a formal driver's evaluation. A couple of other things I'd say too that are maybe a little bit, one is a little bit less obvious, is actually medication administration. I see so many times that people who have dementia are quote unquote taking their medicines. And if you ask them if they're taking their medicines, they say they are, but no one's checking. And I would love to believe that that's true, but I can tell you, having also personally gone into homes for home visits in the past, we find pills on the ground, and family members find pills on the ground, or find a whole week's worth of pills that went untouched. Even sometimes if the dementia is more severe, even with an alarm pill box. And so this is where I often tell people one of the most important things for safety is making sure that we're taking our medicines and we're taking them properly. Because if I have dementia and I can't remember if I took my pain medicine 5 minutes ago, I could double, triple, quadruple on that medicine within hours and land in the ER. So it is very dangerous to not have oversight with medications as dementia progresses. One other big one that's maybe a little more obvious is also finances and scamming. So many times I have so many stories of people come in and say, I didn't know it. My loved one just went and tried to, I actually had a case where somebody printed out $18,000 or had got $18,000 in cash. It was in a box. Just this other week, I heard this story, and they were about to mail it. And thankfully, someone at the mailing office said, "Wait a second, what are you doing?" And it was caught. But so many are lost this way.
Those are some wonderful tips. Thank you so much. If anyone would like to schedule a consultation with you, what's a good phone number for you?
Yeah, our office number is 435-716-4900.
Oh, wonderful. Thank you again for being on here and telling us all about what you do and why you do it. This is the Senior Moment Show. We hope you all tune in again next week.